I think everyone's on that was in the waiting room. So welcome to this bi-weekly office hours of balance of state for COVID-19. We've been recognizing that we've been facing a pandemic, and just recently are now acknowledging the longer and more insidious pandemic that we've been not dealing with in the forefront, and that's the structural racism that our country seems to embrace with relish. And so I know a lot of us are joining the call today with very heavy hearts, and words can't really express all of the emotions that we're all feeling, but we did want to acknowledge publicly and allow that Black Lives Matter, and that we walk with our brothers and sisters of color during these most trying and actually heinous times. So as we take a moment of silence now for those who have succumbed to COVID, we'll also spend some moments of silence remembering those who have been murdered simply because of the color of their skin. So join me now for a moment of silence. Okay, deep breath, everyone. So our agenda is what it always is. We welcome you. Those of you who can see who's on the call can just see who's with us. We'll do some announcements, some updates, and then we've got a lot of really sort of thick and dense updates and reminders through that the Housing Innovations staff is going to walk us through. So under announcements, you'll see, for those of you who have the slideshow in front of you or who have referenced it, just some updated links around screening clients for COVID at shelters or encampments, that those now incorporate a list of current symptoms. Again, for those of you who may be new, or a reminder, these are all live links that when you have your PowerPoint open, if you click on it, it will go to an actual document. I don't think I need to remind folks to mute yourself when not speaking, that the chat box at the bottom is live and is being monitored. So if you have questions in between slides, feel free to ask questions and we'll respond to them either now or later. The next slide shows other recent CDC guidance, checklists, and employer information for office buildings. Again, this may be information that you've seen, but we want to put this information in a couple different places so that whenever you're looking for it, it's readily available to you. Next month, we have our semi-annual meeting where Alice, Steve, and I will beg someone to take over as co-chairs, but if no one's brave enough, that we will humbly continue as your three co-chairs, but wanted to let you know that it's an open and honest and fair election, similar to the ones that we hope we will be having in the fall. Okay, no more politics, John. So that's the Zoom link for that. Reminder of other webinars that are posted from neighbors near and far, from CCEH up to USICH. Again, live links, click on them at your leisure, and just, there's a lot of stuff that's moving at a very fast pace, so it's best to go back to these really wonderful resources often. A reminder that we're here, that if you click on the here word, it's a link. It goes to all the updated responses from previous webinars and times that we've spent together. And on this beautiful weekend, when you're worried and fretted about a particular question, you're just gonna zip over an email to ctbosscoc@gmail.com. And I'm sure by the time you have your Sunday bagel, the answer will be sitting in your inbox. If not, we'll get to it. Okay, so even though we are here with heavy hearts, you know, I can't help it. I have to keep things light. For those of you who can see me, I'm channeling Frank Sinatra, which is also the name on that I've identified myself with. So with that being said, DOH, start spreading the news. Steve?
Okay, sorry about that little muting and unmuting issue. Actually, John, I think you almost look like you should be wearing some lederhosen and do like a Oktoberfest dance with that hat. Anyways, so some of the news from the DOH perspective. In the past couple of weeks, we are once again reminding everyone that we're engaging in a large-scale testing protocol for our entire homeless service system. So the CANs are trying to build relationships with their local healthcare agencies that will be doing the testing, whether it's an FQHC, a health center, or a hospital. So those are going well. We've also worked with the state to find additional resources to do testing, and a bunch of our hotels have already been tested. What we're really working on now is trying to define a couple of things. One is a standardized release of information, so we'll be able to share the information, put it in HMIS, and be able to track those folks who are positive and negative a little bit better, especially as hotels end. We also need to come up with a statewide consensus on how often testing should be done for the homeless population. So that's next. We're also working on strategies for using the state's mobile vans to do testing of the unsheltered population before the end of the month, because we're not sure if we'll have those vans after the end of the month. So we're actively working on that. So once we have some more information, we'll be able to better determine when hoteling ends, how to safely move people back into shelter if needed, and how much isolation space we truly do need, and how to set that up. Also, this Monday, we launched the 1,000 Homes campaign, which is a pretty exciting opportunity to house 1,000 folks within the next 120 days. Pretty daunting, but for once, when we have something like this, we actually have resources available. So DOH is in the process of contracting out its ESG, like I've mentioned before, $2 million for services, $2 million for rental assistance, with the expectation that more ESG funding will come in, which will add additional funds for rapid rehousing, diversion, and rapid exit as well. So we're excited about that. And in the past 2 weeks, we did get approval from the Office of Policy and Management to reimburse the CANs and providers, shelter providers, rapid housing providers, PSH providers, funds that they incurred due to COVID from March to the end of June. I know the CANs worked really diligently with their providers to identify what those costs were. They submitted to us. So the total cost is $2.8 million. We have $2 million approved already, so I'm working on getting those contracts set up while we hammer out the last $800,000 of quote unquote other costs to make sure that they are eligible for CARES Act reimbursement. DOH is also in the process of creating additional programs such as eviction prevention. This week it was also announced there will be assistance for undocumented folks, as well as more funds for folks who may be behind on their rent. But those last three programs are really, really new, just kind of bubbling up this week, so I do not have much more information besides that. But you will be hearing more about that as time goes on. And I think that's enough.
Great. So two things. One is somebody in the office says I look like the guy from AC/DC because I'm wearing shorts. So that's not a band I follow, but if you, and he does the duck dance or the duck walk. Some of you know that. Okay. Secondly, Steve, I've been told it's not a campaign, that campaign is a dirty word. So this is just sort of
Sorry, my mistake. You are right. No campaign, 1,000 homes.
just another walk in the park, another day in the park. Alice, Demas.
Yes, hi. Thanks, John. Thanks, Steve. We were part of the kickoff of the 1,000 Homes soiree, for lack of a better word, since we can't use campaign. So that's been great. A couple of Demas related updates. One, yesterday, CSH, in collaboration with Demas, put on a half-an-hour webinar related to the track phone and SafeLink applications. So I believe that's going to be, if it's not already, on the CSH website. It's just a half an hour, has some good information. We know that the application and the process is very confusing and, can be troublesome to get through. So we hoped to have that kind of explained during the webinar yesterday, so people can go there. I can also ask someone at CSH to send that over to Liz so she can, excuse me, maybe embed it in the notes from today. The other thing I wanted to mention that is not Demas, but is DSS, but related to our folks, or anybody really who's received SNAP benefits. I don't know if everyone saw this, but you can now use your SNAP benefits to order food online. So there are several stores that are engaging in helping people get their food ordered online rather than folks having to actually go to the store to get their groceries. So I think that that's really exciting. That's on the DSS website. I may have sent it to Liz. I may not have. It's Friday and what I've done all week is kind of slipping through my brain. And the final announcement is Demas did get awarded the FEMA Crisis Counseling Program grant. As we talked about in previous meetings, it's a very short-term amount of money to help with crisis counseling for folks who have been affected by COVID. We are targeting folks in the motels, transitioning to housing, and the services have to be related to the COVID pandemic, but they are going to help folks get linked to ongoing services or trauma care that they might need, those kinds of things. And since it is such a short time frame that we're working on, we are really actively have already started the process to get payments out to the agency that will administer, that's ADH, the program for us for the homeless side of things. So everyone should be aware that that is going to be forthcoming. That's really exciting news. It's very time limited, but it is going to be helpful during this time. And so those are the announcements from Demas. So I just want to kick it back over. John, do you want it?
I'll take it.
Okay.
So our most favorite HUD partner is on the call with us, Atlanta Cable.
Good morning, everyone. I hope everyone's doing okay today. First, a couple of things from the Hartford CPD office. If you were scheduled for monitoring this year, you may have already received a letter from me letting you know we are suspending monitoring for the rest of this fiscal year, for the rest of this federal fiscal year. So what that means is we won't be doing any monitoring through September 30th of this year. So if you were scheduled, take a deep breath. We're not coming out to see you either virtually or in person for the rest of this year. And that's, really in recognition of all the additional work all of you are doing, and in recognition of the work that our staffs are doing to get not only the CARES Act funding out the door, but the consolidated plan reviews completed for 22 out of our 23 entitlement grantees. So one, take a deep breath on that. Two, it is time for me to reassign workloads. So within the next, I would say, week or so, you'll receive a letter from me letting you know if your CPD representative has changed. If not, if you don't receive anything from us, the rep that you've had continues to be your rep, so please be on the lookout for those emails. We also continue to roll out the FY19 Continuum of Care grants. You know, keep in mind, we have to make sure that the grant is funded in locks, in our lock system, before we can release the grant agreement to you. But we are fairly well up to date with regard to all of those grants for which we can at least get grant agreements out to you. So if you've got work to do in order to get us to the point where we can release it, I'd encourage you to please do that. With regard to HUD in general, and I see this is going to be covered later on the agenda, we've released an additional waivers that relate to HAPWA, COC, YHDP, and ESG. Those are on top of the waivers that were released on March 31st. You'll see that they give you some additional flexibility and relief to expedite the delivery of assistance during this pandemic. So again, I don't want to take up time with that because I see it's highlighted later on the agenda. We do have a couple of webinars coming up that I wanted to draw to your attention. There is one today on designing and implementing an emergency home program funded TBRA program. I have heard from some of our entitlement grantees that they, or I should say I have heard from some of our home participating jurisdictions that they plan to take advantage of TBRA. So if you do work, I would say in New Britain or potentially throughout the state of Connecticut, you might want to join that 1-hour webinar today if you can. On the 8th of June, we are going to have a HAPWA CV webinar. It's going to be a review of this second mega waiver, which was issued on May 22nd from our Assistant Secretary, our Acting Assistant Secretary. So there'll be more information on that for our HAPWA grantees at that point. And the updated biweekly SNAPS Digest is available for all of you on the HUD Exchange. They updated it just yesterday, so it should be up to date. With regard to the second allocation of ESG funds that Steve alluded to earlier, that has not been released yet, and I don't have an ETA on that, but I do know that if we have instances whereby a grantee hasn't yet submitted for their first round of ESG CV funds and the second allocations are announced, we will be providing advice and guidance on how you can apply for both. You could combine the first and the second allocations, but again, we don't have information on the second allocations yet. But I think my message today would be, don't panic. We are going to give you additional advice and guidance on how to do that so that, you know, if your process has started, you hear about a second allocation, you want to incorporate it, we'll have some guidance for you forthcoming. And I think that's about it for me, John.
Great, thanks, Alana. I have to say, once again, your being on these calls is so very comforting for those in the trenches to know that you're looking out for us and running interference for us and providing us with the necessary funds. So thank you again on behalf of all of us. David, I don't want to scare you, but I think you have a dinosaur in your...
I know. I've been camping out at the museum these days, John. It's my happy place. So happy to invite you all in here to my home environs. So quickly, we've received requests from many of you in response to our announcement with CSH that we had received a donation of cloth masks. Those will be getting boxed up and shipped out next week. We had more requests than we can field now, working on a second round. So be looking for that first wave of responses. The IKEA, large donation from IKEA that we're warehousing. We're working with cans now. Hopefully for delivery out to a central point within each of your cans by June 15th, and things would be further distributed from there regionally. I'll mention that CCEH, we are looking at some recent HUD guidance suggesting that COCs consider COVID susceptibility and underlying health conditions in our prioritization criteria. So for an agenda this afternoon with the Housing Solutions Collaborative, which Danielle Hubley from the partnership chairs for us, that's people who manage by name lists and matching processes in the CANs. We're having an initial conversation this afternoon about what that might look like. Would cycle back to each of our COCs with any more concrete proposal. Please know that we're working on that. And the last thing I'll mention is that we are working with DOH to execute, get the paperwork signed so that the next round of funding for the CANs can go out for the next fiscal year starting July 1. So today and next week, we're going to be looking at our request for assistance process, the proposals and budgets that we've asked CAN leaders for in previous years, and hopefully tweaking and streamlining that. So watch for that in the coming week or two. Thank you.
Great, thanks, David. So any questions for any of our partners? Feel free to type them in. We'll give you a minute to stretch. We're sort of at the half-hour mark.
Suzanne looks like she has a question.
Thank you, Alice.
Yes, Suzanne.
Alana, I don't, thank you so much again for updating us and coming. Any word on the NOFA for the Continuum of Care funds for this year?
No, I did inquire about that after you had asked the last time, Suzanne, and no update yet. Don't know.
Okay.
Sorry.
That's all right. Just checking. I didn't think you would forget to mention it if it was coming out this week or something like that.
Right.
Just suggest to them that they give us the money and be done with it. And also, what a gift that some of us are not being audited this year, because I think I was as a sub-recipient on that target list. So I'm breathing quite easily on that.
That's through 9/30, Alana, right? You said that's through
Correct.
no. Okay.
Correct. And then what we'll do, if we're in a normal routine, typically in November, December of every year, we risk analyze each of our competitive grantees and our formula grantees according to predetermined criteria. Then based upon that risk analysis, we review it with headquarters and come up with a monitoring plan for the year. So if we are back to monitoring in FY 2021, I wouldn't expect that it would start until next January at the earliest.
That's really helpful.
And maybe the folks that were on this year's list get skipped altogether. Just saying. Okay, moving on.
It could be. No, it could be, John, because it will all depend upon, what risk analysis tells us.
Yes.
So
right.
It could be. We have another year of experience with each of our grantees to take into account.
So you're not working from an old list saying, oh, we'll just move those forward. You do starting fresh.
Right. We start fresh every year.
That's so helpful.
Good news.
Yeah.
Thanks, Alana. Suzanne, since you have the mic, why don't you take it away? And folks, again, continue to type in any questions that you have, and we'll get to those.
We haven't gotten anything in the chat box yet, have we? Someone's keeping an eye on it. Okay, so Alana already mentioned this, that there are additional waivers and waiver tool. Yep.
I'm sorry, somebody did mention something in the chat box about, can the link for the home training be forwarded?
Yes, I can send that out.
Okay.
As soon as we get off the call. It starts at noon. So I'll try and get that out to you ASAP. It is up on the HUD Exchange if you can access that, but I'll send it out as well.
Thanks, Alana.
You're welcome.
Thank you. Great. So as I said, Alana mentioned this, that on May 22nd, there was additional HUD waivers, and Our team, Lauren and Liz and Shannon, are busy creating tools so that as we take advantage of additional waivers, and I think most of us are, and you are taking advantage of these waivers, that we're in compliance. And so this slide gives you resources. You see there's a new memo that gives some instructions for everyone and an updated sample emergency policy, which is very similar to the old one, but updated to meet the new waiver thing. So please use these tools. Where now we know from Alana that they won't be out to monitor until January, so you have some time. So we'll remind you again after you're maybe past the frantic part of the crisis to make sure you get your policies up to date. But you should really get things in writing as soon as possible. So if you are a grantee with HUD, and we'll get deeper on this, you need to notify HUD that you are going to use the new waivers, and you should submit the letter notifying them 2 days before you start. And there is an updated resource for if you do need to apply for the waiver, but only about 25 or so funded programs in the balance of state need to apply directly, because many of you were subrecipients under DMIS or DOH. So that's in the detail later. Oh, and that's in the detail on the next slide. I did review these in advance, but anybody who's a subrecipient with DMIS and DOH, they have already taken care of this. And you can implement these waivers as of last week already. Again, if you receive money directly from HUD, do your own. And if you get ESG funds or COC funds, because you might be receiving funds from the ODFC Continuum of Care, you need to coordinate with whoever's receiving the funds there. So the limit on waiver rental assistance for 24 months has been waived. This is big. And that's for anybody who's hitting 24 months after May 22nd. So it's very recent people who are just now at 24 months and can't sustain without continued rental assistance. This expires and has like an open date until there are no more COVID measures in place, which is a line in the sand that probably needs to be determined. And this is only for COC rental assistance, not ESG. So many of you administer both programs. This is for the COC program. This is kind of, maybe we should hear from Alana, but guidance that if you're amending your grant to do things under COVID that you need to do, when you apply in the next competition, you use your old budget. So that's recent advice from HUD, and maybe Alana, I don't know if you can chat in the chat box, or if you're not able to, certainly speak up. But if this is going to change, but it kind of seems a little strange that you're maintaining your old budget line items when you reapply. But we'll keep you posted on this, because as we know, Alana just said, we don't know when the competition's going to be. There was a really little tweak to Dedicated Plus, and Dedicated Plus is going to be a subject we're talking a lot about over the next few months as we implement the process of shifting our resources to Dedicated Plus to enable us to better serve people who don't meet the strict chronic homeless definition. And the minor change is that the transitional housing eligibility that's there, which was previously for people who are chronically homeless or in transitional housing, that was being eliminated through reallocation, that's no longer required at any transitional housing if they were chronic beforehand, which is again good, because some people are chronic, they lose it in transitional, and then we can't see that, serve them.
Suzanne, I think Alana was trying to say something.
Okay, sorry, I don't have the full speaker view on. Thank you. Alana?
Hello, everyone. Yes, can you hear me?
Yes.
I was just down at my laptop. The home TBRA program webinar isn't until June 10th. My apologies. I confused it with something else I have going on at noon today.
Oh, that's good though. So then people can take a lunch break.
Yeah, I just sent that out to everyone. My apologies. We have so many webinars happening, I can't keep them all straight. But I wanted to let you all know that I just sent it out.
Terrific. And people have time to plan for it. So that's terrific,
yeah.
Alana. Thank you.
Yeah.
We're
You're
all
welcome.
multitasking,
Yeah.
using all our devices, right?
Well, I'm typically upstairs in my home working, but I'm using 2 laptops today, and you can't hear me as well from downstairs. So I'm getting my exercise in the house today, which is a good thing.
Great. Well, thank you for clarifying that. Thank you so much. Okay, going forward. So the waiver on COC and ESG case management, the monthly case management waiver is extended until August 22nd. Again, you have to notify HUD. Of course, our advice is to keep in contact with participants and tenants in whatever way we can, text, telephone, video conferencing, as we now start to relax restrictions. Can we meet people in a public place and be 6 feet apart? Those are questions, obviously, we all need to be talking about as a team, because if we lose connection with people, we know they're going to probably have some issues. This is a tough time. So wherever you can, obviously use technology. We know everybody doesn't have technology, but you can get folks' phones. We've talked about that before. To keep in touch, but you won't be out of compliance if you get monitored and you haven't seen people. Just a few reminders: HQS inspections on the initials are still waived until September 30th. You don't have to re-inspect the annual re-inspections till next March, and self-certification of disability is still to September 30th. You can have an initial lease term of just 1 month. We still strongly support getting lease terms of a year where possible, but know that this might provide additional flexibility for some people. There's the waiver on FMR rents for leasing projects. And until next April, which is a long time from now, COC can use the supportive services budget line item to pay 6 months of rent and utility arrears, when that's preventing someone from getting into a new unit. So someone who would be being served in rapid rehousing or permanent supportive housing but can't because of these arrears, you can use that through next April, which is really great. So there's updated guidance. As I said, Lauren, Liz, and Shannon have been really diligent keeping you up to date so you are in compliance. So there's the policy and making sure you're keeping things in the files. Just want to remind you too about hazard pay. I think it's great. Excuse me. A lot of folks are trying to pay hazard pay to staff. It is a tough time for everybody, and our frontline workers don't, make that much money. You have to cover it with existing money when you're using COC funds. You got to have a policy, and you're billing it to the same line as you were billing salaries. So you also need to be fair in this, reasonable. If you're targeting certain staff, like your frontline staff, you want to be that to be consistent and not be discriminatory. And if you are discriminating, to have a reason. And then this is just a little chart that might be helpful for people who love charts, and I know some of you love charts, of the requirements around notification to HUD and documentation in the files of use of these waivers. So you see, when you're the recipient, you have to, when you're getting the money directly from HUD, you have to do everything. And you have to include documentation in participant files. You have to have policies. If you're subrecipient, you still, while you don't have to do all that work with HUD, a notification, you must document in the participant files any use of any waivers. And if you're, of course, authorizing hazard pay with these funds, you want to make sure you have an agency policy. And samples are there. If you need help finding them, email us, and we will help you get them. I see the chat box now. It's a couple of things here. Okay, so Liz put up the link to register for the June 10th webinar. That was super speedy. And then Annie asked, what if someone exits the rapid rehousing program prior to the date that a virtual inspection must be redone? Do we still have to go back and re-inspect in person if they have exited? I don't think so. I don't know if Laura, I've closed my gallery view, so know if Lauren has an answer on that. Or Alana.
If not, I can certainly check with headquarters on that. I mean, logically, I would say no, but I'm happy to double check on that.
Right.
So the question is, if someone vacates the unit prior to the time of the virtual inspection, are our recipients required to go back and inspect, even if their person has left the unit, correct?
Yep.
Okay. I can follow up on that.
Is it reasonable to do an exit inspection virtually with the landlord? I would think so.
Right. I can follow up on that for you.
Thanks, Alana.
Yep, no problem.
So Susie's got the same question for PSH regarding vacated units requiring inspection. So we'll wrap that in as well, Susie.
Thanks. Thanks for the question. Thanks, Alana, we'll follow up with you.
That's a good one. Thank you. No, it is, because now
This crowd
something like
is
I
very,
thought about,
very
you know?
compliant.
Yeah.
Other questions? Okay, well, seeing none, just reminder that our next office hours is the 19th of June, which is also the same day as our semi-annual meeting. So we will give you a half-hour break to grab some lunch and freshen up between the two meetings. As we're now doing 1 week, which is this week, is the deep dive into all the technicalities and the waivers and what have you. And then 2 weeks hence, we have a deeper dive into a topic from the ground. And so the one for the 19th is going to be assessing and responding to child abuse or neglect during the COVID crisis. So that'll be our deep dive during the regular office hours. We'll give you a half-hour break, and we'll come back and we'll sort through the long list of people who have self-nominated themselves to be one of the co-chairs. On the next couple slides are our growing list of resources, again, both locally and nationally and intermediaries in between. So feel free to click on any of those if you have particular questions. And then once again, all of the emails that I'm quite happy to share with you because mine's not on it, which is the staff of Housing Innovations, the great firm that supports all the work of our COC. So are there other questions? Seeing none, I just want to close by saying we live in very precarious times, very scary times. And we want to make sure that you are being kind to yourself and extra kind to the people that you interact with. We don't know what burdens the other person's carrying. And we just want to be as gracious as we can to ourselves and others. So with that, I am going to give you 15 minutes of your life back. Use them wisely and be well. Bye, everyone.